opened your patient portal, seen this red exclamation mark next to your cholesterol numbers, instantly panicking, please don't tell me I need a statin? This video is for you. Today, we're moving past the generic advice. Whether you're trying to manage this strictly through lifestyle or want to maximize the medication you're already taking, this is your minimalist guide. In the next few minutes, we're going to decode the lipid panel, review the latest guidelines on advanced testing, and lastly, break down a dietary strategy that outperforms the standard Mediterranean diet for improving cholesterol. Let's start with the basics. When you look at a standard lipid panel, you usually see four main numbers. To understand them, think of your bloodstream as a highway. Cholesterol can't travel through your blood on its own. It needs to ride inside vehicles called lipoproteins. Right off the bat, you'll see total cholesterol. This is just a combined tally of everything on the road. It doesn't tell us the whole story, so let's look past it. Then we have LDL-C. Traditionally, we call this the bad guy. It measures the amount of cargo inside the trucks on the highway. It tells us the volume of cargo, but doesn't tell us how many actual trucks are on the road. Next, we have HDL-C. Think of HDL as the cleanup crew or the tow trucks, the good guy. Its job is to gather up excess cholesterol and take it back to the liver to be cleared out. For years, we thought higher is always better, but modern science shows it's actually more about how well your HDL functions. Finally, we have triglycerides. This isn't actually cholesterol. It's a type of fat circulating in your blood used for energy. If this number is high, it's usually a direct reflection of your metabolic health because triglycerides react very strongly to refined sugars, simple carbs, and alcohol, not just dietary fat. Now, a standard lipid panel is a good starting point, but it's really just a screening tool. If you have a family history of early heart attacks or heart disease, or if your numbers are borderline and you aren't sure if you need medication, these tests now recommended in the new ACC/AHA guidelines give us much deeper insight. If your physician hasn't brought these up yet, they are absolutely worth asking about. First up is ApoB. Let's go back to our highway analogy. If LDL measures the amount of cargo, ApoB counts the number of trucks. Because every single plaque-causing particle has exactly one ApoB protein attached to it, checking your ApoB gives you a much more accurate picture of how crowded your highway actually is. If your LDL looks normal, but your ApoB is high, you are still at an increased risk. Number two, Lp(a). Think of Lp(a) as a standard LDL particle, but it's covered in slime. It's highly sticky, highly inflammatory, and much more likely to get trapped in your artery walls and cause plaque. Lp(a) is almost entirely determined by your genetics, meaning it stays pretty much the same throughout your life, regardless of diet or exercise. You typically only need to check it once in a lifetime, and while there isn't a current medication specifically targeting Lp(a) on the market at the moment, there are therapies fast-tracking through clinical trials for FDA approval in the very near future. Knowing this number now helps your healthcare team tightly manage your other risk factors. Number three, hs-CRP. This is a simple blood test that measures systemic inflammation. While a standard CRP test looks for massive spikes from acute infections, hs-CRP detects very low levels of chronic underlying inflammation. Number four is the CAC or coronary artery calcium score. This isn't a blood test, but it's a super quick, low-dose CAT scan of your heart that takes less than 5 minutes. Now, it's important to know that a CAT scan does not measure non-calcified plaque, which is the soft, active plaque most likely to cause an acute heart attack. So why do we still check it? Because calcified plaque and soft plaque coexist. The amount of calcium acts as a surrogate marker for your overall plaque burden. Now, although calcified plaque cannot be reversed, meaning the score won't go down, studies consistently show that lifestyle interventions can significantly slow its progression. All right, now let's talk strategy. If your cholesterol is elevated, what should you actually eat? If you want a strategy that was specifically engineered by medical scientists to slash cholesterol, you want to look at the portfolio diet. The portfolio diet was developed by Dr. David Jenkins and colleagues at the University of Toronto as a plant-based dietary pattern. For years, we knew this diet worked beautifully in short-term trials. But then, a study that followed over 200,000 people for 30 years across 3 separate Harvard-led studies was published and solidified its success. They found a clear trend. The more closely people followed this dietary pattern, the greater their protection. In fact, those with the highest portfolio scores had a 14% lower risk of heart disease and stroke and significantly lower lipid and inflammatory markers like those labs we just talked about. The philosophy here is brilliant. A lot of different foods can lower LDL cholesterol by a little bit, maybe 5%, 10%, but if you combine them into a single portfolio, they work together to give you a massive reduction, up to 30% lower LDL. The diet is naturally low in saturated fat and focuses on adding 5 simple pillars to your routine. Number 1, plant proteins. Swap out most poultry and red meat for soy and legumes. Think edamame, tofu, lentils, chickpeas. Number 2, nuts and seeds. A daily handful of walnuts, or my favorite, adding chia seeds or ground flax to your favorite recipes. Pro tip here, be sure to eat ground flax since whole flax seeds pass through the body undigested, meaning you won't absorb the nutrients or fiber. Number 3, viscous fiber. This is a sticky, soluble fiber found in oats, barley, psyllium, apples, berries, citrus, sweet potatoes, okra. In your intestines, viscous fiber acts like a sponge, binding to cholesterol-rich bile acids and dragging them out of your body before they can hit your bloodstream. Pro tip here, plain psyllium husk powder is an incredible concentrated source of this. Number 4, plant sterols. Found naturally in nuts, seeds, and plant compounds, but mainly fortified products such as cereals, spreads, and yogurt. These have a molecular structure that mimics cholesterol, which actually blocks your gut from absorbing the real thing. You need about 2 grams of plant sterols daily to see a noticeable reduction in LDL cholesterol. Number 5, healthy monounsaturated fats. Simply swapping out your butter or lard for extra virgin olive oil or avocados. The minimalist rule here for this dietary pattern is simple. You do not have to be perfect. Harvard researchers found a clear dose response, meaning every single one of these pillars you manage to add to your dietary pattern lowers your risk over time. If you want just one high impact habit to start with, try this. Focus on getting more soluble fiber every day. That's where I'm starting. Small, sustainable shifts will always beat radical, stressful diets that you abandon in 2 weeks. In our next video, we're going to pivot from the kitchen to the supplement aisle and talk about cholesterol-lowering supplements. Do red yeast rice, berberine, or fish oil actually work? Which are worth spending your money on? If you want to find out, make sure you subscribe so you don't miss out on that. Now let me know in the comments below, have you been told you have high cholesterol and what's the advice you've received? I'm Dr. Raj. I hope you found this information helpful here today. Be well, and I'll see you next week.